As Belize anticipates the arrival of its first full-scale allocation of approximately 100,000 doses of vaccines through the COVAX facility, anxiety continues to build about the effectiveness of the vaccine. Several questions come to mind. The most important, can I contract COVID-19 after I take the vaccine? The simple answer is yes, but if you do, the symptoms will be less severe.
For persons that are vaccinated and they come in contact with someone with measles, and by any chance their immune response was not the best, they might get the measles, but very mild, they wouldn't even know they have the measles. And the same thing can happen with COVID-19. We know that they reduce the transmissibility, but there is transmission that can occur. But what they are certain of with all the vaccines, COVID-19 vaccines, is that it reduces the severe illness, hospitalization, and death. So it is COVID-19 vaccine save lives.
Worldwide, many governments have decided that the best way to fight the pandemic is through herd immunity, through vaccination of 70% of the population. In Belize, that's around 242,000 persons. The grouping for which the AstraZeneca's vaccine can be administered is ages 18 years and older, and they make up 58% of Belize's population.
This is just one more disease that will protect us against COVID-19, and it's what the world is saying is that we only can be safe if all of us are safe, and that means beside wearing the mask, beside physical distancing, washing the hands, cleaning down surfaces, stay at home, vaccine will play a big role in reducing the number of COVID-19, especially severe illness and deaths.
And even before the vaccine rollout takes place, there is already resistance from some members of the public. A poll has determined that only 53% of healthcare workers have agreed to be vaccinated whenever the vaccines are made available.
We don't have any polling so far for the general population, but we already started the conversation at district level. The district teams are meeting with their stakeholders and getting the information out on the importance of the uptake of the COVID-19 vaccine. The healthcare workers, right now we are collecting information on their acceptance of the COVID-19 vaccine, which we expect will be high because they are the ones that are in contact with these patients with COVID-19, and they are the ones that are working the extra hours and going the extra mile to provide the regular services plus the services from the COVID units. So the report that I saw earlier, with just a subsample of that, showed that at least 53% of the healthcare workers are willing to accept the vaccine now. 35% still need a little bit more information, and 12% were saying no.
The Ministry of Health and Wellness has embarked on an information campaign on vaccines. Duane, Moody for News 5.